In a dialysis unit, the steady hum of machines is the most obvious sound. It's a rhythm of life-sustaining technology, a constant reminder of the vital work happening. But, listen closer. Beneath that hum, there is another, more human rhythm. It is the quiet conversation between a nurse and a technician. It is the thoughtful discussion between a dietitian and a social worker. It is the careful coordination that ensures every patient receives the safest, most effective care possible. This is the unseen symphony of teamwork, and it is the true heartbeat of any successful dialysis center. Without it, the best technology in the world is just machinery. Many people think of healthcare as a series of individual actions. Disclaimer: this video is intended for educational purposes only and must never be used as medical advice. Please consult your doctor about any personal health concerns. Communication is the circulatory system of any healthcare team. If it is weak or blocked, vital information cannot get where it needs to go. In a busy dialysis unit, patients and staff change every shift. A structured handoff is essential. This is where the SBAR method comes in. SBAR stands for Situation Background Assessment Recommendation. It organizes information so nothing gets lost. It turns a casual chat into a focused report that protects patients. Real example: outgoing PCT hands off Mr. Henderson in chair 5. Situation: his blood pressure dropped to 90/50 about 30 minutes ago. We gave a saline bolus per the nurse's instruction. This immediately alerts the next PCT to the most urgent issue. Background: Mr. Henderson is a 68-year-old patient who often experiences hypotension late in treatment. He mentioned he felt a little lightheaded and didn't eat much before coming in today. His target weight is 70 kilograms and we are still about 1 liter away from reaching it. Assessment: I believe his blood pressure drop was due to his fluid removal rate combined with not eating. He seems to be stabilizing now, but he is still at risk. Recommendation: I suggest you recheck his blood pressure in 15 minutes. Please keep a close eye on him for any signs of cramping or dizziness. Also, encourage him to have a small snack once his pressure is stable post-treatment. This structured handoff leaves no room for ambiguity. The safest dialysis treatment is one where problems are prevented before they can ever happen. This requires a culture of proactive awareness. Every team member acts as a safety detective, constantly scanning for hazards. Frayed electrical cord on a blood pressure machine, unlabeled syringe on a countertop. Individually they may seem minor, but in a high-risk setting these oversights can cause patient falls, equipment failure, medication errors. Develop a keen eye for safety. Conduct regular safety huddles or hazard hunts. At the beginning of a shift, take 5 minutes to walk the treatment area together. Actively look for things out of place. Emergency carts stocked and accessible. Chemical containers labeled and stored. Pathways between chairs clear of clutter. This trains everyone to use a safety-first lens. Consider a small, clear fluid spill near a patient's chair. Place a wet floor sign. Clean it up promptly. See it, own it, fix it. Brief pause. If you enjoy this video, please take a second to like and subscribe. Also check the description below for links to additional useful resources. Dialysis care is incredibly complex. It goes far beyond the mechanics of filtering blood. It involves managing diet, medications, fluid intake, emotional well-being, social challenges. No single professional has all the answers. This is why a multidisciplinary team is the cornerstone of high-quality patient care. Let's imagine a patient, Mrs. Garcia, whose lab results show high phosphorus levels, and she has been missing treatments. A nurse might focus on the medical implications. A technician might observe that Mrs. Garcia seems withdrawn and tired during her treatments. These are important but incomplete pieces of the puzzle. The social worker then provides another critical piece of information. Mrs. Garcia's son moved out of state. With this complete picture, the team can now develop a truly effective and compassionate plan. The social worker can connect Mrs. Garcia with transportation assistance programs. The dietitian can work with her to create a budget-friendly, low-phosphorus meal plan. The nurse can then educate Mrs. Garcia on the importance of her treatments. This collaborative approach doesn't just treat the lab value, it treats the whole person. When they collaborate, they create a holistic 360-degree care plan for the patient. Each member brings a unique lens and a specialized skill set. This collaborative approach doesn't just treat the lab value, it treats the whole person, addressing the real barriers to her health and well-being. In the constant motion of a dialysis unit, it's easy to just move from one task to the next, one patient to the next, without ever really pausing to think. However, the greatest opportunities for improvement are often found by looking back. Reflection is the practice of thoughtfully considering our actions and their outcomes. It's a form of self-assessment. It lets us understand what went well, what could have gone better, and how we can apply those lessons in the future. For a dialysis team, structured reflection is a powerful tool. One effective way to practice reflection is post-shift debriefs. The team can gather and ask 3 simple questions. What went well today? What were our biggest challenges? What is one thing we can do differently tomorrow to make things smoother or safer? This ritual creates a safe space for honest conversation and collective problem solving. It helps the team identify patterns they might miss when they're caught up in the moment. During the debrief, a technician might say, "The new admission process this morning took much longer than expected." They don't assign blame. They pinpoint a system issue. That insight leads to improvement. They might create a new admission checklist, or assign one person to manage new admissions. In many workplaces, feedback is a word that, causes anxiety. It's often associated with criticism or those formal performance reviews. But in a high-stakes environment like a dialysis unit, feedback should honestly be viewed a bit differently. It should be seen as a gift, a vital piece of information shared to protect a patient or improve a process. Creating a culture where feedback is given and received constructively is one of the most important things a team can do. It requires trust, respect, and a shared commitment to excellence over ego. Everyone must feel empowered to speak up, no matter their title or seniority. Giving feedback effectively is a skill. It should be timely, specific, respectful. Instead of saying, "You're always rushing," which is vague and accusatory, a more constructive approach would be, "Hey, I noticed when you were cannulating Mr. Smith just now, you didn't seem to pause for the full 30 seconds after applying the antiseptic. I was concerned we might increase his risk of infection. Can we talk about it?" Receiving feedback gracefully is equally important. The natural reaction to criticism is to become defensive. In a safety-focused culture, team members must learn to pause and listen. A good response might be, "Thank you for pointing that out. I was feeling a bit rushed, but you're right, patient safety comes first." It's reinforced when leaders model both giving and receiving feedback well. When a clinic manager thanks a technician for pointing out an error they made, it sends a powerful message. It is safe to speak up here. This psychological safety is the foundation of a highly reliable team. When feedback flows freely and respectfully in all directions, the team develops a collective awareness that makes everyone, and every patient, safer. The field of nephrology is, honestly, always evolving. New research emerges, technologies are updated, best practices are refined. The skills that make for an excellent dialysis professional today may not be sufficient 5 years from now. So, ongoing professional growth isn't a luxury, it's a necessity. Lifelong learning isn't just about CE credits. It's about curiosity and a shared desire to improve. True teamwork means helping each other grow. Planning for growth should be collaborative. One team member presents a short summary of a nephrology article. Identify collective knowledge gaps. If patients start a new type of home dialysis, arrange manufacturer training. Make sure everyone is confident and competent. Individual growth plans matter too. New technician, cannulation certification, experienced nurse, mentor new grads, or lead the clinic's quality improvement committee. Supporting growth builds careers and clinical expertise. As individuals grow, the team grows stronger. Continuous learning tells patients, we won't settle for the status quo. The journey of professional growth never ends. It's an ongoing, lifelong process. We have explored 6 distinct steps to building a stronger, safer dialysis team. But these steps do not exist in isolation. They're interconnected and mutually reinforcing. Imagine a patient, Mr. Lee, is experiencing unusual swelling in his access arm. The PCT who first notices it, Maria, immediately recognizes this as a potential safety risk. She knows this needs immediate attention. Maria communicates the concern to the charge nurse, David, using SBAR. David, I have a situation with Mr. Lee in chair 12. His last treatment had high venous pressures. I am concerned he may have a clot forming. They decide to stop the treatment early and arrange an urgent ultrasound. Later, during a reflective debrief, the team discusses the incident. Maria is praised for her sharp eye and clear communication. The team decides to add a question about access swelling to their pre-treatment checklist. The clinic manager schedules an in-service on advanced access assessment for the whole team. In one event, all 6 principals came together to protect the patient and strengthen the team. We began this journey by describing teamwork as the unseen symphony of dialysis care, from the structured clarity of an SBAR handoff to the humble wisdom gained through reflection, clear communication, proactive safety, multidisciplinary collaboration, reflection, feedback, growth. These are not abstract ideals, they're day-to-day behaviors that build a fortress of safety around every patient. Practice these 6 steps until they're second nature. We elevate our profession, we protect our patients, we honor the profound trust they place in us. Teamwork is the heartbeat of exceptional dialysis care. Thank you so much for your precious time. If you enjoy this video, please take a second to like, subscribe, and share. Also, check the description below for links to additional useful resources.